Good afternoon, everyone. My name is Danielle Bubness, and on behalf of the Pennsylvania Cancer Treatment Fairness Coalition, I would like to welcome you this afternoon. Thank you for giving us the opportunity to introduce you to the issue of oral chemo parity and its importance to patients living in the state of Pennsylvania with cancer. Before I move forward, I would like to take a moment to recognize our 20 partner organizations on the Pennsylvania Cancer Treatment Fairness Coalition. We represent a wide range of patients and professional organizations across the state. And I commend each for their passion and commitment to ensuring access to treatment for our cancer patients and families living in Pennsylvania. The Leukemia and Lymphoma Society, American Cancer Society Cancer Action Network, Patient Advocate Foundation, Pennsylvania Society of Hematology and Oncology, the Pennsylvania Medical Society, the Pennsylvania State Nurses Association, Pennsylvania Breast Cancer Coalition, the Hospital and Health System Association of Pennsylvania, Cancer Support Community, International Myeloma Foundation, International Cancer Advocacy Network, the National Brain Tumor Society, Community Oncology Alliance, Susan G. Komen for the Cure, Association of Community Cancer Centers, Patient Services Incorporated, Premier Oncology Hematology Management Society, Penn State Cancer Institute, UPMC Cancer Center, University of Pittsburgh Cancer Institute, and Fox Chase Cancer Center, Temple Health. 80,000 Pennsylvanians will be diagnosed with cancer this year, and over 28,000 will lose their battle with their disease. These numbers are significant. However, we are at a very exciting time in the development of cancer therapies and cures. Oral targeted therapies can selectively kill cancer cells versus normal cells. And even more exciting, nearly half of all the new cancer drugs in the pipeline are oral oncolytics. Patients can remain at home, continue to work, and live quality lives while being treated for their disease. However, the development of these or any new therapy is not enough. We have to make sure that our patients can afford and access their treatments. Oral anti-cancer treatments often have significantly higher out-of-pocket insurance costs to the patient than those administered intravenously, forcing patients to absorb thousands of dollars in out-of-pocket costs each month. The cost for targeted oral and targeted IV chemotherapy is comparable. However, when administrative costs associated with IV chemotherapy are factored in, facility fees, nurse time, drugs and supplies, the total costs associated with oral medications are often less expensive. Chairman Matt Baker has proposed legislation that will provide for equal access to anti-cancer treatments. The legislation will prohibit health insurers from charging a high coinsurance payment for oral anti-cancer medication, ensuring patients can access the treatment prescribed to them. Studies have found that high out-of-pocket costs directly impact compliance with oral chemotherapy medications, negatively impacting patient health and long-term healthcare costs. And furthermore, a study from Prime Therapeutics found that 1 in 6 cancer patients with high out-of-pocket costs abandoned their medication at the pharmacy. Patients with an out-of-pocket cost greater than $200 were at least 3 times more likely not to fill their prescription than those with out-of-pocket costs of $100 or less. 34 states have enacted similar legislation to control out-of-pocket costs for our cancer patients, including all border states, Ohio, New York, New Jersey, Delaware, and Maryland, with the exception of West Virginia. And our coalition is committed to making Pennsylvania number 35. The Pennsylvania Cancer Treatment Fairness Coalition would like to thank Chairman Matt Baker for his commitment and dedication to this important issue. Chairman Baker introduced HB 2471, which was successfully voted out of the House yesterday. We are truly grateful for his passion and couldn't have asked for a more dedicated champion for cancer patients in Pennsylvania. So please help me to welcome Chairman Matt Baker.
Thank you very much. It's a great honor to share the podium with my colleagues this afternoon, but especially the Cancer Coalition advocates and cancer patients, one of whom just is also recovering from knee surgery, it appears, and she has great strength and resolve to be standing here this long. But what an exciting day it was yesterday to be in the Capitol to pass nearly unanimously, with the exception of one vote, the oral chemotherapy or parity bill. This is a game changer, ladies and gentlemen, for cancer patients. It's going to increase affordability and access to heretofore cost-prohibitive, state-of-the-art oral cancer therapy, oral pills that are at a higher tier, and in most cases are just cost prohibitive. This will level the playing field for so many patients, cancer patients. It'll make it affordable, accessible, and the efficacy level of oral cancer pills is just so much better. It'll reduce travel time. It'll increase the quality of life for so many cancer patients. And it just gives me a chill to think that no matter what we do down here or up here, no matter where you're from, east, west, north, or south, we're going to do something substantial. We're going to help cancer patients. My goodness, how could you be against helping cancer patients? They're suffering enough. They're dealing with so much financially, emotionally, physically, and the least we can do is to help our cancer patients across the Commonwealth of Pennsylvania. You know, I had some prepared remarks, but I'm just going to can them because this is the day to be very, very joyous. We passed that legislation yesterday. There's momentum in the Senate to get something done. I'm very excited about the possibilities for all cancer patients everywhere. And again, over 80,000 cancer patients are going to be diagnosed each year. 22,000, unfortunately, on average, lose the battle to the fight against cancer. But we can do something very, very exciting, very, very helpful, and my goodness, I'm just proud to stand here with so many wonderful individuals. I'm proud of each and every one of you, members, cancer patients, advocates. God bless you all. Thank you very much for your support. Oh, that's yours.
That's okay. Thank you, Chairman. And I have the pleasure of introducing you to one of our patient advocates this afternoon, Kathy Hawkins, who is going to share a little bit about her journey with oral medications. And Kathy really represents the Pennsylvanian cancer patients who will be affected by this legislation. Kathy?
Hi, my name is Kathy Hawkins, and I was diagnosed with leukemia in January of 2008. The diagnosis came as a complete shock to me, as I've always lived and tried to live a very healthy lifestyle. I exercise, I eat right, I don't drink, and I don't smoke, so I thought I was clear. Unfortunately, when I heard the word leukemia, I thought it was going to be a death sentence. And what my doctor told me at the time was that 10 years ago, it would have been a death sentence. However, with today's wonderful medication, the oral chemotherapy pills that are being introduced, I am able to live life as if I did not have a disease at all. The problem that I'm experiencing more than anything at all is that when I went to fill my first prescription, The doctor told me and the pharmacist told me that the medicine was going to be expensive. And what I was thinking, expensive, was $40 or $50 for a copay, because generally you can get a script filled for about $1 or $2. When I had my prescription filled, the pharmacist came to me and said that my out-of-pocket costs for 1 month prescription was going to be $1,700. Unfortunately, I had to tell him that I did not have the money. I work as a secretary in a private school, and the out-of-pocket costs of my medicine equates to more in a year than what I make in my salary. The unfortunate part is that I was not going to be able to afford this life-saving chemotherapy pill. Had my doctor told me that there was a different type of pill, or if I could have the intravenous pill to go to the hospital, unfortunately, there was none. My only chance of survival was the oral chemotherapy pill. If I were going to go to the hospital and get the IV treatment, I would have to pay a normal copay, which would be the equivalent of $25 every time I went there, instead of the outrageous $2,000 a month cost. I was my own advocate, and I called every place I could possibly think of for assistance to help me pay for the cost of my out-of-pocket expense. I found 2 separate places, and unfortunately, a month ago, the funding ran out for both. I was in my room, and I was calling just for a refill for my prescription, and they told me the bad news that they had no more funding to offer me and that I was going to have to start paying these out-of-pocket costs myself. I didn't know what to do, so I spent about 3 hours in my room crying. My son, who is with me today, who's 13, came to me and he said to me, "Mom, he's been saving his money since he's been 2 years old. And he asked me to take him to the bank, and I asked what for. And he told me he would like to get all his money out of the bank for me to help me pay for my medicine. I don't want to bankrupt my son, and I don't want to bankrupt myself. This can be solved, and the way this can be solved is by passing this bill. We are begging the Senate to pull together and pass this most important legislation so that no cancer patients have to be bankrupt in order to live. It seems to me like we are moving forward in the right direction. I applaud the members of the House who have all stood behind me, and I am asking for the members of the Senate to do the same, to work together and to get this bill moving in a fast manner, and to have this bill turn into a law by the end of session, which would be the end of next week. They have the choice, and the choice is you can help the cancer patients or you can help the insurance companies. I am asking for them to help the cancer patients and help people like myself and everyone in the state of Pennsylvania who is unable to afford this life-saving medicine. Thank you.
Well done, Kathy.
Thank you so much, Kathy. Our next 2 speakers are 2 of our coalition partners, Diane Phillips from the American Cancer Society Cancer Action Network, and Kathy Levins from Fox Chase Cancer Center. Diane?
Really, we're here today about an issue of fairness. As you have heard, scientific advancements during the past several years have increased the availability and effectiveness of oral medications for cancer treatment. Approximately 1/4 of all oncology drugs in the development pipeline are oral medications, and many oral chemo drugs have already been approved by the U.S. Food and Drug Administration. However, as you've heard, health plans often require higher cost sharing for oral chemotherapy drugs than drugs administered intravenously by a physician. This disparity can affect patient and physician decision-making about treatment options and may even lead patients to forego the best treatment for their situation. In addition, research suggests that the high cost sharing for oral chemotherapy medications may lead patients to actually abandon treatment, and you've just heard a very real life story about just that. Oral chemotherapy, when available, can offer advantages to patients and caregivers. So let's be practical. It can mean less frequent visits to a doctor's office or a cancer treatment center, less need to schedule long appointments for infusions, and less worry about finding transportation to and from appointments. This flexibility is particularly important for people living in rural areas of the Commonwealth who otherwise would have to travel long distances to the nearest facility. And it's also important for employed patients and family members who are trying to reduce hours away from work during treatment. A recent study found that cancer patients with monthly cost sharing of $500 or more were 4 times more likely to abandon the prescribed chemotherapy drug than cancer patients with cost sharing of $100 or less per month. Imagine having cancer and not being able to afford the out-of-pocket costs for your treatment. As we know, and we've just heard, to date 34 states and Washington, D.C. have passed oral chemotherapy fairness legislation, and the purpose is to help equalize patient out-of-pocket costs for oral chemotherapies and IV chemotherapies. Cancer patients' access to oral anti-cancer drugs has improved as a result of those actions, and it's something we want to see here in Pennsylvania. In fact, we want Pennsylvania to be that next state. As was noted yesterday, the House passed the House Bill 2471 with overwhelming support. Today we are asking the Senate to move the bill out before the end of session. Really, it's a question about fairness for Pennsylvanians.
Good afternoon. On behalf of Dr. Richard Fisher, the president of the Fox Chase Cancer Center of the Temple University Health System, I just want to again thank Chairman Baker and members of the General Assembly for their leadership on this issue, not only on this particular act, the Oral Chemotherapy Parity Act, but also in their tireless efforts for basically tearing down barriers to care across the Commonwealth. One of the things that at the Fox Chase Cancer Center, we are completely dedicated, solely dedicated to treating patients with cancer and finding the cures for those cancers. And we have found that the only way to be successful in that mission is to ensure that our patients have full access to the care that they need. I just want to commend Kathy Hawkins and your son for your courage in taking up this cause, because it's very, very important to us, and to the members of the General Assembly for their leadership on this. As noted, we have found that many of the patients who come to Fox Chase Cancer Center who can't afford the copays give up the care. They leave their pharmaceuticals at the drugstores. This prevents them not only from getting the care they need, but it also impedes the research mission and prevents us or limits our ability to find those cures. So again, I just want to commend the General Assembly for their courage in taking up this issue and request that the Senate also take the lead on this and pass this swiftly. Thank you.
Thank you so much, ladies. And our final speaker today, another supporter of HB 2471, Representative DiGirolamo.
Thank you, and good to be with everybody today. And I would just like to acknowledge behind me the presence of Liz Yarnell, who's on my staff on the Human Services Committee and is also a cancer survivor, so she knows how important this bill is. This is really, very briefly, a two-part story. First, my good friend from Tioga County, Matt Baker, a perfect example of him getting a hold of an issue and moving it through the House of Representatives in an almost incredible amount of time. Only through his effort did this bill get out of the House yesterday and over in the Senate. I want to commend Matt for his effort and hard work. And the second part, I knew very, very little about this issue till about 6 months ago when I had a meeting with some advocates and a young lady who's over here on my right, Kathy Hawkins. And we sat at dinner and she talked about her story, a little bit of what you just heard out here. Only because of her persistence, her dedication, her hard work, has this bill made it this far and over to the Senate. She is an amazing woman, and for her, my friends, it's not an issue. It's life and death for her. Life and death. You heard the story of her just recently. She didn't know how she was going to afford her medicine, and her son, Nate, right here, offered to go into his savings account and buy his medicine. It's an issue of life and death, not only for Kathy, but for many people across the state of Pennsylvania. And I'm going to stand here and beg and implore the Senate and the Senate leadership to find a way to get this bill done, if not this week, then next week when we're finally in session. Let's get this done. It's absolutely the right thing to do for Kathy and all the cancer patients who live in the state of Pennsylvania. Thank you.
Yes. And I just looked over, and we are so grateful to have Representative Benninghoff with us here as well today. Would you like to say a few words?
My apologies, and I will be brief. One of the things I wanted to add to the many great comments that were made is we're also trying to give families normalcy. That might sound like a simple thing, but those of you who've had your family touched by cancer, you know that the C word or leukemia changes things, and you spend a lot of time trying to figure out what normal is. Normal continues to change on a day-to-day basis. Why should we require families or individuals to have to travel for hours to get to a facility, sit for hours in a chemo lab, have infusions done, only to leave there oftentimes not feeling very well, and travel for hours to get back home? That doesn't even talk about the lost FTEs for employees who have to leave their work, their spouse that may share it with them, or their children, or whatever else. Kathy's gracious friend provided transportation to her today. With a tough issue going on with her leg, even just driving a car is a challenge. We're only asking for simple normalcy in people's lives, fairness by being able to take a pill and get tremendous results. In Kathy's situation, she doesn't have a choice, so she has to pay more money because there's not a choice. I'm thankful for my members of the Cancer Caucus and other members of the colleagues that stand behind us today. I have faith that our friends in the Senate can get this done, and I'm thankful for you folks to join us and for you inviting me as being part of it. I'm honored to chair the Cancer Caucus, but can't do it without my great colleagues behind me. Kathy, your son are a great inspiration, and we get called honorable and we get all the titles, but you are true leaders in our Commonwealth, and we really want to bless you. God bless you, folks.
Thank you. And on behalf of the Pennsylvania Cancer Treatment Fairness Coalition, we thank you for being here today. I thank you to our speakers, partner organizations, patient advocates, and everyone for listening to the importance of this issue. Thank you, Kathy, for sharing how important this is to our cancer patients in Pennsylvania. If you'd like more information, we do have packets. If you have any questions, we can be available. Thank you.
Thank you.